Let's talk about the different acne lesions that you'll find in the 4 stages of acne. Up first, we have open comedones, also known as blackheads. These form due to excessive cellular debris, so think built up skin cells and oil clogging the pores. Now, because the surface is open, the melanin in sebum reacts to oxygen and turns them black, giving them their name blackheads. Now, up next we have closed comedones. These are also referred to as whiteheads, and these occur when the follicle becomes completely clogged, but it's closed at the surface, unlike the open comedone that appears black. A closed comedone that appears white will often vary in shade from a whitish to a flesh-colored tone, and they cannot be pushed out, but they often appear together, open and closed comedones. Up next, we have papules. Now, these are small, red, inflamed bumps that are often cone-shaped and really small in size, generally less than 1 centimeter in diameter. Now, they lack a white or pus-filled center. They're just small, red, inflamed bumps. They can often be quite irritating and sore to touch. You can see here that they're featuring as well with open and closed comedones. Then we have pustules. Now, pustules are small red bumps found on the skin that have a white or pus-filled center. Now, both papules and pustules are an inflammatory form of acne, but the key determining factor here is the pus-filled center. Now, this is when bacteria has infiltrated the follicle, leading to that accumulation of white blood cells. Both can be painful to touch. Then we have acne cysts. Now, these are large, inflamed, and very soft to the touch. They can almost have like a smooth appearance because the skin is so stretched. They contain fluid and pus and are really quite painful, especially if they're not deep beneath the skin due to extreme inflammation and bacteria infiltration. When bumped, they can really throb and cause a lot of pain. They're quite large and they can rupture, leading to scarring. And last off, the most severe form of an acne lesion is called a nodule. And the key difference between nodules and cysts are that cysts are very soft and typically have that white center, whereas a nodule is extremely hard, almost like a knot has formed underneath the skin. They're large, they're red, they're inflamed, they're very deep, and they're solid to the touch. Having a clear understanding of these different forms of acne lesions is vital in diagnosing which stage of acne you or your clients are currently suffering with.